Why am I not losing weight even though I'm eating less and exercising? Several factors may explain a weight loss plateau, including metabolic adaptation, inaccurate calorie tracking, water retention from exercise, or an underlying medical condition such as hypothyroidism. Have you ever stuck to your diet, kept up with your workouts, and still seen absolutely no change on the scales? You are not imagining it, and you are definitely not alone. Before we go any further, everything in this video is for general information only. Please speak to a healthcare professional for advice tailored to your own situation. This is one of the most common frustrations people face when trying to manage their weight. A stall does not automatically mean you are doing something wrong, but it does mean something is worth looking at more closely. So let's walk through what the evidence actually says. The first thing to understand is something called metabolic adaptation. When you reduce your calorie intake over time, your body responds by lowering the amount of energy it burns each day. And it is not just your resting metabolism that drops. Your body also reduces the energy used in everyday movements like walking, fidgeting, and general activity. This is essentially a survival mechanism. What this means in practice is that a calorie deficit that was working for you in the early weeks may simply not be enough anymore as your body adjusts. The second major factor is calorie tracking accuracy. Research suggests that people underestimate their food intake by anywhere between 20 and 50%, even when they are actively tracking. The most common culprits are liquid calories, sauces and condiments, and portion sizes that are slightly larger than estimated. Small amounts can add up surprisingly quickly. It is also worth knowing that starting or increasing resistance training can temporarily push the number on the scales up, even when fat loss is actually happening. This is due to fluid retention and increased glycogen storage in the muscles. And for women, natural hormonal shifts across the menstrual cycle can also cause short-term changes in body water that mask genuine progress. So the scales alone do not always give you the full picture. Now, sometimes the reason for a plateau goes beyond diet and exercise. There are several medical conditions that can genuinely make weight loss harder, including hypothyroidism, polycystic ovary syndrome, also known as PCOS, and Cushing's syndrome. Certain prescription medicines can also affect weight, including some antidepressants and corticosteroids. If you are on any regular medication, it is worth discussing this with your doctor, but please do not stop or change any prescribed medicines without speaking to your doctor or pharmacist first. So, what should you actually do? If you have been in a well-tracked deficit for 8 to 12 weeks with no progress at all, that is a reasonable point to book an appointment with your GP. And if you are experiencing other symptoms alongside the weight stall, things like persistent fatigue, hair loss, or irregular periods, speak to your doctor sooner rather than later, as these can be signs of an underlying condition that needs investigating. If your GP does identify a medical cause, or if weight management remains difficult despite your efforts, there are NHS options available depending on your individual circumstances. These include structured weight management programs, a medication called Orlistat, and in some cases access to semaglutide, available under the brand name Wegovy through specialist services. Bariatric surgery is also an option for some people. Your doctor can advise on what you might be eligible for. A quick recap: metabolic adaptation is real. Your body actively adjusts to a calorie deficit over time. Calorie tracking is harder than it looks, and small inaccuracies can make a significant difference. The scales can be misleading due to fluid shifts from exercise or hormonal changes, and if lifestyle changes are not working, there may be a medical reason worth exploring with your GP. As always, speak to a healthcare professional for advice tailored to your own situation, and never stop or change prescribed medicines without their guidance. If this was helpful, drop a comment below and let us know what topics you would like us to cover next. Give the video a like if you found it useful, and subscribe to Bolt Pharmacy for more evidence-based health content.